All right, so what we're gonna be doing is the home exercise program for an anterior hip replacement. So first what we're gonna do is we're gonna do some seated hill slides. So the patient will be seated and then a towel is placed under the foot, or if they're just in socks, you can use that, but I prefer a towel. So all you're gonna do is you're gonna bring your foot out and then bring it back in towards the chair, and we're gonna do that 20 times. Are you having any pain at all with that?
No.
Okay.
Hasn't been 20 yet.
Okay, so now what we're gonna do is we're gonna do a long arc quad. So all you're gonna do is you're gonna kick this foot out and basically just straighten it out as best you can. Okay, then you can just set it back down. Yep, and that's all we're gonna do. So you're just gonna bring it up and then bring it back down. For the video purpose, she's just gonna demonstrate 5, however, I would want her to do 20 to 30 reps of these. So now we're gonna do a short arc quad. So I stuck a bolster underneath the patient's knee. So all you're gonna do is you're just gonna straighten this leg up, okay, and then just put it right back down. For video purposes, she's only gonna do 5. However, I'd have her do 20 to 30, depending on how much she's progressed. Okay, so now what I'm gonna have her do is do a quad set. So basically all she's gonna do is try to push her knee into the table and then hold it for about 3 to 5 seconds. And then for video purposes, I'm only gonna have her do 5, but I'd make her do 20 to 30 depending on the situation. And as you can see, when she pushes down, her quad muscles tighten. You can also add a towel or something underneath the knee to show that they're pushing the knee down into the table. Okay, so this time what I'm gonna have her do, just like I did in the chair, is I'm just gonna have her do a active range of motion heel slide to see just how far back she can bring her heel towards her bottom. So for video purposes, she's only gonna do 5, however, I would make her to do 20 to 30. And if they don't have socks on or on a slick surface, then I'd put a towel underneath the heel and then pull it back that way. Okay, and then for the next one, what I'm gonna have her do is do an active assistive. So basically, she's gonna have the towel or a sheet or something that's long underneath the foot. She's gonna hold on to this. And then all she's gonna do is do a heel slide while pulling. So she's gonna bend the knee and then pull that foot towards her, and sometimes they can get an even bigger increase in range of motion. Then you just slide it out. Again, for video purposes, she's only gonna do 5 when I have them do 20 to 30. finally, you want to lay back. We're going to do a straight leg raise. So all she's going to do is she's going to use what she did with, did you stop it? No. Never mind. Okay, so finally what I'm going to have her do is do a straight leg raise. So she's going to use what she did with the quad set. So she's going to tighten her quad to keep her leg straight. And she's just going to bring that leg up to about right here. And then bring it back down. And then for video purposes, she's only going to do 5. We're not have them do 20 to 30. You also don't want them to go up very high because if she goes up higher, this makes it actually easier. So if she keeps it lower, then it's a lot more difficult.